Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about emergency services and the certifications that help the public know where to seek the fastest, most effective care in their area. We'll learn about Certified Trauma Center, Accredited Chest Pain Center, and Primary Stroke Center from 3 guests from St. Tammany Health System. We'll start off with Bethany Monistere, who is Trauma Services Manager for St. Tammany Health System. Bethany, welcome to the program.
Hello, thank you for having me.
I'm excited to have you here. We're going to talk a little bit about what a trauma center is and what St. Tammany Health System has to offer people who are in need in that situation where trauma response is necessary. So maybe let's start right off the bat with, what is a trauma designation?
So our trauma designation comes from the state of Louisiana, but we're also accredited by the American College of Surgeons. So we went through a vigorous accreditation survey where the American College of Surgeons comes in and they have a certain protocol that we have to follow. It's where we have resources available 24/7 for patients who come in critically injured from car accidents or gunshot wounds, stab wounds, unfortunate events that can happen. But we're prepared 24/7 for this, and the American College of Surgeons really provides that blank protocol for hospitals to follow.
Okay, so that American College of Surgeons designation or certification suggests that St. Tammany Health System and your team have gone through the training and have the personnel, the people with the specialties and the backgrounds, and that all of those resources are drilled and trained and ready so that when a trauma happens, this facility is prepared.
Correct.
Okay. Well, then that trauma center designation is a little bit of a badge of pride, but really it is there to create some confidence in our public to understand that we're ready to take care of them in these kinds of emergencies.
Absolutely.
And you mentioned that aside from the American College of Surgeons, that this is also a designation with the state of Louisiana. And that's part of a larger emergency response network. So can you talk a little bit about what our state puts together for emergency response?
So part of our state is the Louisiana Emergency Response Network. It's a great part of our government that works with emergency personnel, first responders, and our hospitals. So when there is a hurricane or a bad car accident on the interstate that has multiple victims, they work together in their communication center to route these patients so not everyone ends up at the same hospital. It spreads out all of the patients throughout all of the resources that we have throughout the entire state, and it's a really good asset for our hospitals locally and statewide, especially when we have things such as hurricanes or tornadoes or really bad accidents, because our main corridor on I-12 is a very, very busy, heavy traffic area.
Very good. So for those of us who are not clinical people or don't work in emergency services or in trauma care, we really don't think on a moment-to-moment basis about what would happen if an emergency occurred, how we would be transported to a hospital, or how that hospital could be chosen. And what you're saying is there's an enormous amount of thought and logistics and planning statewide and regionally, and then here very locally within the 5 hospitals in our area.
Yes, we do. We have a strategic plan, and we work very closely with our first responders. So every ambulance company that we have throughout our region is very familiar with each and every hospital. We communicate on a daily basis of what services we have and what we can offer to the public. So if you do fall down and break your leg, yes, it's an accident, but that is still considered trauma. So you don't want to end up at a hospital that doesn't have a service that can provide you the care that you need. So our local first responders can bring you to the appropriate hospital that can take care of your needs in a timely manner.
So in the case of a trauma, where, you talked about the interstate, well, all the first responders are going to respond to that. You're going to have ambulances responding to that. The LEARN network is going to be in action, sending those ambulances to each hospital with the appropriate care. But for someone, as you mentioned, who's broken a limb, that kind of a trauma, there may be a private decision going on of, do we throw someone in the vehicle and drive to a hospital? Should we call 911? Can you talk for a minute about the role of making that phone call 911 in a trauma situation?
So 911 is one of the best resources that anyone has at their fingertips. So we always advocate in the emergency department to pick up the phone and call 911. A lot of residents don't realize you get care before you get to the hospital. You have an IV placed, you have pain medicine that they can give you, oxygen if you need it. It's very important, and they give the hospital that brief 5 to 10 minutes to get ready for everyone on the team to be prepared for what's coming in their doors. The emergency room is always prepared for whatever walks in, but when we have that brief 5 to 10 minute heads up on what's coming in, it actually helps our team better prepare for what's coming in. So when you come in and you do have 20 people at your bedside, it is for a reason. Everyone has their task, and we get things done very quickly. And this is with any kind of incident that you have, whether it's a trauma or a heart attack or a stroke. It's very important to call 911 and not try to put someone in your vehicle and drive them all the way to the hospital by yourself.
Okay, so for those of us who are not clinical people, you know, we find ourselves in a situation and it's up to us to decide how to respond, and we're thinking, oh, if I call 911, we're going to have to wait. We actually need to rethink that, because if we call 911, that wait is actually shorter, because the minute that those medical professionals show up at our door, they can begin intervention, they can begin medical care that we would not have if we were trying to drive to the hospital.
Yes, ma'am.
And then in addition to that, I heard you say that once I get to the hospital in my private vehicle, you have everyone ready, but you don't know what's coming in the door, whereas the ambulance has already communicated.
Yes, so our EMS personnel call a designated phone line that we have in the emergency department. So we have a clear line of communication with EMS. We know what's coming in. We can have, whether it's the trauma surgeon or the orthopedic, which can fix bones, and or if you're having a heart attack or a stroke, we can have that equipment at the bedside that we need ready for you. It may take, you know, if you walk in our front door with a trauma, it may take a couple of minutes for us to get the special equipment that we need. We are prepared, but we can be better prepared when you do come in with emergency personnel.
Perfect. And so that's a thing that a private citizen can do, is call 911. But another thing that private citizens can do if they're trained is help to stop the bleed. And you have a whole program called Stop the Bleed that you're doing in the community. Can you tell what that program is, and then how we can go about getting signed up to get trained?
Absolutely. So Stop the Bleed is a worldwide program that part of the American College of Surgeons put together, training that anyone, medically trained or not medically trained, can learn to stop bleeding, because the #1 cause of a preventable death is bleeding. So this is something that we can train anyone to stop someone from bleeding to death. And as tragic as that sounds, if we can be proactive and we can train someone how to apply a tourniquet or how to apply appropriate amount of pressure to a bleeding source until first responders get there, they have the potential to save someone's life. So we're not using blood products that we don't need to use, and we don't want to be wasteful with our blood products. And if we can train the lay public on how to stop the bleed, just like we would with, some people get worried with CPR because it's a lot of stuff to remember. Stop the Bleed is basic training. We do provide classes to the public. You can sign up for those classes at sttammany.health. We have a couple, 1 to 2 a month, and we offer these classes to the public. We have also taught these classes in St. Tammany public schools to our teachers and staff members there, so they are prepared. So you can feel a little bit safer when you're sending your children to school.
That's beautiful. Bethany, thank you so much for this. Stop the Bleed and helping us understand a trauma center and what's important about calling 911. Thanks for coming in.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about emergency services and the kinds of certifications that help the public know where to get the fastest, most effective care in a trauma, a stroke situation, or when having a heart attack. We'll be right back.
We're not doing a lot of traveling these days, but when you think about it, everything we really need is right here close to home. Like world-class ortho care at St. Tammany Health System. Many firsts. Many smiles. Many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about emergency services and the certifications that can help the public know where to seek care. We spoke first with Bethany Monistere, who talked with us about a trauma designation and the Louisiana Emergency Response Network. Up next is Jeff Meyers. Jeff will talk with us about Accredited Chest Pain Center designation and how that helps people to get care for a heart attack or heart failure fast. Really excited to have you here. So I was talking to Bethany about these certifications, and I said, you know, in some ways it kind of feels like a gold star, a proud achievement. But really what these certifications do is help the public see that this is a place where you can get this particular type of care. In her case, she talked about trauma. The Accredited Chest Pain Center, can you talk about that designation and what that means for the public?
Sure. We accredited through the American College of Cardiology, also known as the ACC. Basically, it's a systematic approach and time-sensitive protocol where it allows our physicians to take care of a patient in the early stages of them possibly having a heart attack.
So if someone is experiencing chest pain, that may or may not be a heart attack, and their first inclination might be, oh, it's probably nothing, but when someone is experiencing chest pain, they really should take action.
Absolutely. And the first thing to do, if you are having chest pain, please call 911. That is the best and most effective and accurate way of getting to the hospital.
Okay. So with the chest pain designation, that means that St. Tammany Health System and its emergency department have special specialists in place. They have special training with the personnel. They have special equipment. And there's some things about speed that I want you to explain, because we have a tendency to think about things going fast as maybe not being a good thing. And in the case of a heart attack, the faster we're able to take care of someone, the less damage is done to their heart.
That is correct. So with the accreditation, we have to adhere to certain policies, procedures, and protocols. And by doing that, that will expedite, well, we have either met or exceeded our expectations to get the chest pain accreditation.
Okay. And so nationally, the American College of Cardiology that issues this designation, their recommendation is that a chest pain center should be able to take care of someone who's experiencing chest pain from the time they present at the door in an ambulance or by just showing up, from the door to the point of care, which is the point at which a balloon is being inserted to reinflate
A blocked artery.
Thank you,
Yes.
blocked artery. See, I'm not clinical and you are. So that time, which is called door to balloon, American College of Cardiology wants that to be 90 minutes, right?
Yes, the benchmark is 90 minutes.
Okay,
Yes.
but at St. Tammany Health System, it's not 90 minutes.
No. We have so far from January to June of this year, our average time is 50 minutes.
50?
From door to balloon.
Under an hour?
Yes, ma'am. So from the time they present to the emergency room, when they're being assessed, calling out cath lab, and when they get to the cath lab suite, where the doctor goes ahead and opens up the blockage, is 50 minutes.
50. And you told me about one very recently that thanks to the coordinated efforts of emergency response and our team and the cath lab, it was a 19-minute door to balloon.
That is correct. 19 minutes was sometime last week, yes.
That's really excited. And it isn't just about how fast can we do this, because there's a reason behind that speed. Every minute is muscle loss, is that right?
That is correct.
So talk through, if I'm completely non-clinical, I know only what you guys teach me, and the public doesn't even have the benefit of working at a hospital like I do. And so those of us who don't do this for a living, Why does it matter to hurry?
It matters to hurry because every second that, or every minute I should say, that you're not at the hospital getting cared for, then part of that muscle is dying. So as they say, time is muscle.
Okay, so a heart attack or heart failure, those kinds of heart emergencies, what's happening is going to cause permanent damage to my heart.
Correct.
And the faster we're able to intervene and get that heart back into the rhythm it's supposed to have, doing the job it's supposed to do to keep my body's blood flowing.
Yes, ma'am. Less damage.
That's less damage.
Yes, ma'am.
And so that means that I'm back onto my life and back where I belong with my family and my job and the things I like to do.
Yes.
Okay. So we have Accredited Chest Pain Center from American College of Cardiology, and what that says to people is, if you are experiencing chest pain, this is a safe place, this is a fast place, this is a place that knows what to do in the event of that kind of an emergency.
Yes.
So that's something that each of us in the public can be aware of, is what kind of facilities are available to us. And as you said, one of the most important things we can do is just call 911, because as Bethany explained, that Louisiana Emergency Response Network is going to make sure that those first responders are taking us the right place.
That's correct.
But completely aside from how we get to the hospital or whether we need to go to the hospital, there are things that we can know about the signs and symptoms of a heart attack just in our everyday lives, when we're at the ball field or we're at work or we're out with a friend at the movies. Someone could be experiencing the signs and symptoms of a heart attack. So can you outline for us what those are so that we can watch for them?
Some of the signs and symptoms typically is crushing chest pain, could be pressure, it could be pain going down the left arm and also the right arm, neck pain or jaw pain. Anyone, nausea, if you may be throwing up, maybe you're sweating, sometimes you just feel fatigued. So those are the early warning signs, which there's a little pamphlet we have on our website called EHAC. It stands for Early Heart Attack Care. And those are the signs and symptoms I just said. If you're experiencing any of those at any time, especially with the crushing chest pain, and it doesn't go away, the best thing to do is call 911.
Okay, so if I'm out and about with friends and I have somebody who keeps kind of saying they're having this jaw pain and they feel funny, we might want to go ahead and call 911.
Yes, please do.
And so we could be in a situation where we're catching a heart attack early. I like that EHAC, Early Heart Attack Care.
Yes.
And so you can do some training on EHAC. If folks want, you can come out and do a training for groups like Rotary or for school groups. And can you let us know, is that on our website?
It is on our website.
So sttammany.health?
Yes, ma'am.
And in the cardiology section of that website?
Yes.
And so we can also always call 898-4000 and ask for Jeff.
Yes, ma'am.
Okay, Jeff Meyers is who we would ask for, and he is our chest pain accreditation coordinator and has talked with us today about how to find the signs and symptoms of a heart attack, the importance of calling 911, and to know that your emergency department at St. Tammany Health System is an accredited chest pain center for heart attack.
Here on the North Shore, along these halls, there are many minds at work. At St. Tammany Health System, many innovations happening now, and even more on the horizon. Many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. We've been talking today about emergency services and the certifications that help the public know where to seek care in the event of a trauma, chest pain, or a stroke. We're speaking next with Toby Tournillon, who is going to talk with us about the Certified Stroke Center designation at St. Tammany Health System. Toby, welcome. We're glad to have you on the program.
Thank you for having me.
Yeah, excited to see you today. And we're talking a little bit about these certifications and how they help people know what's going on. A Certified Stroke Center. Talk to me about what that means and why that helps the public.
So we are a primary stroke center, and what that means is that we have the processes and protocols in place to care for the stroke patient from the time they arrive at our emergency department to the time of discharge. When a person arrives in our emergency department with symptoms of a stroke, care begins immediately so that we can quickly assess and provide the interventions necessary to determine if the patient is a candidate for TPA. So TPA is a medication that we give our stroke patients that helps, it's given through an IV, and it dissolves the clot over an hour.
Wow.
So the quicker we can get the patient TPA, the better chance the patient has for having a positive outcome.
Okay, so similar to what Jeff and I were talking about with a heart attack, and the faster we get care for that heart muscle, you're saying the same thing in the case of stroke. The faster we can get that patient and begin that care, the more likely we're able to make a difference in that stroke. And the way to stop that stroke is with TPA.
That's correct. So with a stroke, it's the same concept as with a heart attack. We also call it a brain attack.
Oh.
And so when you have a lack of oxygen flowing to your brain, which that's what a stroke is, it's a lack of blood flow, brain cells die every minute that you go untreated. So we say time is brain, and the quicker you can get to the hospital and get intervention, the better your chances are of recovering.
Wow. And that's where a primary stroke center obviously is the place to be. Not everyone can administer TPA, and if TPA, if it takes too long, then you can't administer TPA, is that right?
That's correct. We closely monitor our times from the time the patient arrives to how long it takes us to give TPA. And so our goal is within 30 minutes.
Wow.
And we accomplish that because we have that protocol in place to quickly care for that patient.
Outstanding. So one of the things that I think makes the difference for the primary stroke center is not just the emergency response, but the capabilities and specialties of the people on the team. And you're part of our neurosciences department. So can you talk for a minute about your role in stroke for neuroscience?
Yes, so neuroscience is a specialty that's really, the need is really growing in our community. And we are expanding our neuroscience program with the help of our Ochsner partners. We have the Ochsner neurosurgeons that are available to provide surgical interventions for those with surgical needs. We also have our Ochsner neurologists that are consulted and are available to help guide the care of our neuro population.
Outstanding.
We have now a dedicated neuro ICU and a neuro med-surg area that allows us to cohort our neuro populations in one area. And by doing that, this allows our nurses who work on that unit the ability to specialize in neuro. So it's really a growing specialty that we're really embracing.
Fantastic. So St. Tammany Health System neuro department has nurses who are specialized in neuro.
That's correct.
And then through the partnership with Ochsner Health, we have the surgeons and physicians who are neurospecialists.
Yes.
Outstanding. And together they're part of that stroke response as well as other types of neurosurgery, brain surgery, et cetera.
That's correct.
And then I think, you know, one of the things that we talked about, everything that we've been looking at is inside the facility. So when someone arrives at the hospital, the response is fast. We can administer that TPA. We have the neuro ICU. Those are all once we're involved. For the public, what can we do as lay people to prevent stroke or to be on guard to respond to stroke?
Sure. I think the most important thing for the community to know is the signs and symptoms of a stroke. And we like to use the Be Fast acronym.
Be fast.
Be fast, B-E and then fast.
Okay.
So B stands for balance. This also implies dizziness. Now dizziness is a very common symptom, but when you have dizziness in the combination with some of the other Be Fast symptoms, then that can be indicative of a stroke. E is for eyes, so we're looking at a sudden visual loss in one of the quadrants where they're unable to see out of maybe a portion or a piece of their visual field. If you look at the patient, they may have double vision, or like I'm looking at you and your eyes are straight, but when you look at a patient that could be having a stroke, maybe one of the eyes is pulling off to the side. Oh. So that falls under the E for eyes. Then we have F for facial droop. So ask the person to smile and see if there's symmetry from the left and right side of the mouth.
Okay.
Usually you'll see like a facial droop, or when they smile, it'll be a little bit off.
Okay. And then
A is for arms. So if you think the patient's having a stroke, have them hold their arms up for 10 seconds, just like this, palms down. And you're looking to see if one of the arms drifts a little bit.
Okay.
Or maybe they can't hold the arm down. So strokes are typically unilateral, so it's good to have them compare both arms at the same time if they can, and look for that drift on one side. Also with the arms, we're looking for any kind of sensational loss, maybe a loss of sensation in one side, either the face, the arms, or the leg. And this also applies, to the legs, where you want to ask the patient just to hold their leg up for 5 seconds and see if there's a drift in that one leg on that one side.
And so that was A, arm.
Arms.
Now we're to
so
S.
now we're moving on to speech. Lots of stroke symptoms that could be possible. So S is for speech. We're looking for slurred speech, or maybe the inability for the person to get the words out. So a simple thing you can do is say, hey, what is this? And what is this? And see if they can identify those items. Another thing with speech is maybe they can speak, but they don't understand what you're saying. And so ask the person to follow 2 commands. Say, hey, can you give me a thumbs up? Or can you show me 2 fingers? And see if they can follow those commands. If not, they may be having a stroke. And then T is for time, because time is brain. So we want to make sure when you do identify those symptoms, you want to note the time that the symptoms started, if it was witnessed. If it was not witnessed, it's important to determine when was the last time the patient was seen without any signs and symptoms. And we refer to this as the last known well.
Last known well.
Yes. So when we just identify the time the patient was last seen without any signs and symptoms, and we get them to the emergency department, if that patient arrives within 4.5 hours, they may be a candidate for TPA. But if they're outside that window, then TPA is not going to be an option for them.
Wow.
So time is really important. The quicker you get there, the more treatment options you have, and the better chance you have of having a positive outcome.
Perfect. So that's why be fast.
Yes.
Balance, eyes, face, arms, speech, time.
Yes.
Outstanding.
You got it.
Be fast to
Yes.
prevent a stroke or to take care of it really quickly.
That's correct.
Toby, thank you so much for coming in. This was really educational. I appreciate learning about the Primary Stroke Center and about Be Fast.
Thank you for having me.
You've been watching Healthy Living, brought to you by St. Tammany Health System. We talked today about emergency services and the certifications that can help the public know where to seek care in the event of a trauma, chest pain, or a stroke. I'm your host, Melissa Hodgson, and we'll see you next time on Healthy Living.